Hi, I'm John Mascarenhas from the Icahn School of Medicine at Mount Sinai. Today we'll be talking about pacritinib for the cytopenic myelofibrosis patient. There are a spectrum of patients with myelofibrosis that range between the cytopenic MF patients. These are the patients that are typified by cytopenias, thrombocytopenia, anemia. They tend to have less extensive or significant splenomegaly. They're enriched for patients with primary myelofibrosis, and they often have a low JAK2 B617F VAF or RJAK2 wild type, as opposed to on the other side of the spectrum, the proliferative patients, which tend to have a high JAK2 VAF, usually secondary MF, often large spleens, and robust blood counts. In an analysis from the PERSIST-2 study, which was the randomized phase 3 study comparing pacritinib at 400 milligrams once daily, 200 milligrams twice daily, or best available therapy in patients who could have seen ruxolitinib previously and could receive ruxolitinib in the BAT arm, we specifically took out the patients dosed at 200 milligrams twice daily. These were 57 patients receiving pacritinib, and 12 patients received ruxolitinib in the BAT arm and compared their outcome measures. We learned four main things from this analysis. One is that the pacritinib dosing was maintained in terms of dose intensity, whereas there was attenuation of dose with ruxolitinib, and this speaks to the ability to deliver the full dose of one drug over the other in the setting of thrombocytopenia. Second is that the responses in terms of SVR 35% were superior with pacritinib 200 milligrams twice daily compared to ruxolitinib, 28% versus 11%, and the total symptom 50% reduction was superior with pacritinib, 37% versus 11%. Three is that there was a overall survival benefit, although these are small numbers, with a hazard ratio of 0.5 in favor of pacritinib. And three is that four is that the toxicity profile was comparable between these two arms in terms of total adverse events, infectious adverse events, and cardiac adverse events. And in fact, if one looks carefully at the grade 3-4 cardiac adverse events, actually the frequency was higher in this small population of ruxolitinib compared to pacritinib. So it establishes both the efficacy, benefit, and safety profile of pacritinib compared to ruxolitinib in patients with low platelets that are able to maintain the full dose of pacritinib, which is unlikely to be the case in many patients who receive ruxolitinib in this thrombocytopenic patient population. Therefore, there's a sense of a spectrum of patients in which pacritinib is particularly geared well for the cytopenic myelofibrosis patient.